and we don't put sunscreen, we don't put skincare on our neck, and also constant moving of the neck, okay, looking at our handphones and tablets will also cause the neck to age faster than the rest of our body.
Okay, hi everyone, welcome to another episode of Ageless Uncovered, where we have doctors unpacking knowledge on different topics. So for today, we are very honored to be joined by Dr. Lam, Medical Director of Ageless Medical, and also Dr. Vera, Aesthetic Doctor of Ageless Medical too. So for today, we are going to talk about the topic, what causes turkey neck? So most people focus on the face, but the neck is often revealing age even faster. So for today, we are talking about something that people don't notice until it shows, which is turkey neck. So why does the neck set, and why do bands appear, and why does it seem to age faster than the face? So for today, Dr. Lam and Dr. Vera will break it down for us, the whole topic about turkey neck. So as usual, we're going to start with a myth or fact section. So these are some statements that we have often heard from people and want to hear about whether it's a myth or fact. For Dr. Lam, maybe you can share with us whether, for this statement, turkey neck only happens to older people. Is this a myth or a fact?
It's a fact. Turkey neck only happen in older people, as you see in the image. However, horizontal necklines, or we call it necklaces, can happen in very young people, even in babies and in teenagers, because usually these are congenital neck bands.
I see. Okay, for Dr. Vera, genetics plays a big role in neck aging. Is this a myth or a fact?
Well, I think that is both a myth as well as a fact. Yes, genetic does play a role, but I think in this day and age, our daily lifestyle also plays a very huge role in neck aging.
Okay, and this is the third statement that we usually hear. You should use the same skincare routine for your neck as your face. Is this a myth or a fact, Dr. Lam?
Absolutely a fact. I always tell my patients, whatever you apply on your face, however expensive the skincare is, you should also go into the neck. And as what Vera has mentioned, even your décolleté, and even the skin on the back of the hands, because these are the areas that will actually show your age, besides your face, the neck, and the skin on the back of the hands.
I see. Now let's dive deeper into what actually causes turkey neck and why the neck ages differently. So for Dr. Lam, do our necks actually age faster than our faces in general?
Definitely so. As I mentioned earlier, the skin on the neck is thin. There's less fat, therefore there's less support, less collagen and all that. And of course, the skin on the neck and the skin on the back of our hands are two of the most underappreciated and over-neglected areas of our body. There's constant sun exposure, and we don't put sunscreen, we don't put skincare on our neck, and also constant moving of the neck, okay, looking at our handphones and tablets will also cause the neck to age faster than the rest of our body.
Wow. So we actually need to protect our neck and put more sunscreen at
Absolutely.
skincare.
Yeah.
I see. So we do see a lot of necklines happening across people. There are horizontal necklines, there's also vertical necklines. So we do see horizontal necklines even in younger people. Why is that so, Dr. Vera?
Well, so I think horizontal necklines, essentially they are congenital, they're what we call congenital. So what I mean by congenital, it means that it is present since birth. So even my 2-year-old baby girl has these necklines as well. But what I have to say is that, given our current lifestyle, whereby a lot of us are actually on our, handphones, our tablets, we are just regularly texting, playing games, all this can actually aggravate the necklines as well, these horizontal necklines. Furthermore, I think a lot of our friends, we neglect our neck, we don't really put our skincare on our neck. So dehydrated skin, and as with age, the neck skin becomes thinner. This can cause the horizontal necklines to become more prominent.
More visible also. What about the vertical neck bands, Dr. Lam?
Okay, the vertical neck bands are actually caused by platysmal muscles. These muscles actually arise from our collarbone. It goes all the way up to the lower part of our face, okay? And as we age, these platysmal muscles weaken, it separates, all right? And it also becomes hyperactive. They contract. Therefore, when they contract, it will pull down the lower part of our face. That's why a lot of devices that we use now can actually tighten the platysmal muscles to actually give us a very nice neck lift. So because of all these aging process, the hyperactivity of the platysmal muscles, the loss of collagen as we age, due to sun exposure, due to the process of aging itself, actually cause these vertical neck bands to appear. If you have vertical neck bands and you have congenital neck bands like me, then that makes it worse, right? You got a double whammy. You've got this and you got this. That's why you need to take care of the skin and the neck, and that's why you may have to see your friendly aesthetic doctor to seek treatments to actually target different vertical neck bands and the horizontal necklines that you have on your neck.
Wow. So is it correct for me to say that, let's say the horizontal necklines is actually congenitals and due to lifestyle habits, and then for vertical backlines is part of aging process due to UV rays and all?
And also aggravated, like what Vera has shared, due to your lifestyle and all that. All that can cause both your vertical neck bands to form and then the horizontal neck bands to worsen with age. Yeah.
I see. So I do notice that when I start applying skincare on my neck, right, it responds differently to the face. So my face usually absorb better and things happen better for the face rather than the neck. Why is that so?
Okay, yeah, so exactly right. I mean, the results for the neck actually takes longer because the barrier is weaker for the neck. And the skin in our face as well as the skin in our neck is very different, all right? So for the skin in our neck, there is less collagen, less elastin, all right? So because the neck skin is thinner, all right, it absorbs and it loses moisture faster. That being said, it also contains fewer oil glands, and so you may notice that the skin in your neck actually dries out faster as well.
Not as oily also.
Yeah, exactly right. You don't really see so much acne breaking out in the neck as compared to, over at the face area.
Yes. So how does the sun exposure contribute to turkey neck?
Well, we've discussed this in the previous episode, right? With UVA rays and UVB rays, it can actually damage either the surface area of the skin or it can damage deeper to cause pigmentation by causing inflammation and then causing your collagen to break down. And of course, when collagen break down and then you have formation of lines and wrinkles, of course, sun damage can cause pigmentation. So if you expose your neck constantly to the sun rays without protecting it, of course, you can have signs of aging on the neck earlier due to sun exposure.
So how can we protect ourselves from turkey necks? How can it be prevented?
So a lot of things. So when we talk about turkey neck, to prevent it from happening might be a tall task. So first thing first, we talk about delaying the process of aging on the neck. So we mentioned just now, right? You take care of your neck like you take care of your face. Okay, so you want to apply whatever expensive skincare you have in your face, you put on your neck as well. Don't neglect it. That's number one. Number two, if you put sunscreen on your face, you also must put sunscreen on your neck, right? And as Vera has mentioned, even on the décolleté, if you want to have a nice skin, of course it includes the skin on the back of the hands, then also you want to not always be scrolling on your phone at night, right? Or your laptop, bending down the neck to look at your iPhone and your laptop, okay? You try to prevent that. And I think also maintaining a good posture is important. If you keep hunching over your laptop and your iPhone, it's going to worsen all your congenital neck bands and even your vertical neck bands. Actually, congenital horizontal necklines, no matter what you do, is not going to disappear. So you might need to seek some preventative measure, like doing some simple energy-based devices, visiting your friendly aesthetic doctor, simple procedure to just maintain the skin on the neck, to maintain the elasticity on the neck.
I see. So I also do notice that some of my friends, when they undergo some weight change, sometimes getting more weight and then losing more weight very, very quickly, they do see more neck lines. Is that true?
Yes, definitely. I mean, both weight loss as well as the weight gain can actually make this turkey neck more noticeable. And what is worse is that if let's say your weight goes on a yo-yo, meaning that it goes up, down very quickly there constantly, we do know that repetitive stretching as well as shrinking can actually weaken the collagen. And so your neck skin actually it loosens faster because it is just naturally thinner. So I just wanted to mention that, for weight loss, we lose the fat under the chin, okay? So your skin becomes loose, all right? If the elasticity is poor, meaning that if let's say, you just go on a crash diet, all right, you lose your weight very quickly, your skin actually can't bounce back. And so the sagging becomes more obvious. And for weight gain, once you pile on this extra fat under your chin, your neck becomes heavier, it becomes fuller, and this stretches the skin over time as well.
Oh. So we mentioned a lot about turkey necks and the prevention methods, but what happens if we already have turkey neck and horizontal necklines? Is there treatments available for this?
Yeah, I mean, fortunately for us, in this clinic, we have a variety of machines, okay, that ranges from totally non-invasive to minimally invasive. So one of my favorite machine, okay, and everybody knows this, is our Therapy Prime, right?
Our Therapy Prime Queen. She does the most in the clinic.
Wow.
Yes, so our Therapy Prime, essentially, what it does is it uses micro-focused ultrasound under visualization to actually target the SMES layer, which is our superficial musculoaponeurotic system. So it stimulates collagen from deep within upwards to actually diminish these necklines. Another of my favorite would be the monopolar radio frequency, okay? So what it does is that it stimulates collagen from top downwards to also help with these necklines. Another one would be the Morpheus 8 treatment. It is a micro-needling radio frequency device that also, again, helps with collagen stimulation. Now on to the non-invasive, more non-invasive treatments, all right? What we also have here is the Onda Pro, something that is very, very popular in Korea, in Taiwan, as my patients tell me. So what it uses microwaves, all right, to target your superficial skin layer to stimulate collagen. This is something that I do quite frequently for myself as well. You can do it on your neck, you can do it on your face, your arm. I actually used it for my postpartum pregnancy skin changes on my belly as well. And another one is the Ageless RF. It essentially uses radio frequency to help you improve your skin condition and your skin necklines as well. So, I mean, given that we've talked so much about these energy-based devices, Dr. Lam, would you like to elaborate more on the injectables that we have in the clinic?
My favorite, okay. So I think first thing first, to improve already developed, especially vertical neck bands, one of my favorites is actually botulinum toxin injection. What does this do is that you inject it into the vertical platysmal neck band itself to actually relax the hyperactive platysmal muscles. So these muscles, when they're hyperactive, they pull down the jawline. When you relaxes it, it will relax downward pull on the jawline. So it gives you a very nice lifted appearance. Actually, it's named after Queen Nefertiti, the very famous Egyptian queen, to give you a very long, slender looking neck. So this is for targeting the muscles. So if you want to target the loss of collagen, the elastin, and the hydration, we can actually inject this product known as regenerative injectable skincare. Basically, this skincare contains both high and low molecular weight hyaluronic acid, and when you inject it into the neck, either by using a cannula or through a 10 injection point, it helps to hydrate because we know hyaluronic acid absorbs water into the deep layer of the skin. It also helps to stimulate the growth of collagen and elastin, our two favorite words in the clinic. Obviously, it also helps to plump up the skin. Okay, this one it belongs to the field of regenerative medicine, and of course, one of the favorite that I like to use is biostimulators. Okay, these actually contains product like PDLLA or even PLLA. We inject it using cannula to actually, in the superficial layer of the skin, to actually stretch the skin and stimulate the growth of collagen and elastin. Now I can only think of these three. Vera, can you think of anything else or not that we do?
Yeah, something that I use quite often as well. Those are the polynucleotides.
Yes. I remember.
Polynucleotides.
My favorite.
Based skin rejuvenators. So these can either be from salmon or from trout sperm DNA, all right? So essentially what it does is that it supports your skin repair and regeneration by improving the skin's natural healing process. Another one that we also have in our clinic is the type 1 collagen from equine, which is horse.
Yes. That's also one of our favorite, right? And I think, Vera, one of our favorite is also PDLLA skin booster.
Yes.
Both of us, yeah. That one we can use it with a cannula that is a higher concentration.
Yes. Or the injector gun that personally I do it on quite a lot of my patients as well, and I really like the effects because of the collagen and elastin synthesis as well as the hydration factor that it gives.
Wow. Thanks for sharing. I think I heard more than 10 over treatments in the clinic.
Yes, there are so many.
There are so many treatments available. So if you do have turkey necks or horizontal necklines, not all hope is lost. you can always come and visit us at Ageless Medical and visit doctor for consultation. They can always give you the best treatment advice from there also. So I think that wraps up today's episode on what causes turkey neck and what treatments are available for you. A big thank you to Dr. Lam and Dr. Vera for joining us and helping us to understand why the neck often ages faster than the face and what really contributes to sagging, lines, and those pesky neck bands. Yeah. So remember, the neck deserves the same care as your face, and early habits make a big difference later on. If you enjoyed today's episode, remember to like, share, and subscribe. And see you in the next one.
Horizontal necklines, no matter what you do, is not going to disappear. So you might need to seek some preventative measure, like doing some simple energy-based devices, visiting your friendly aesthetic doctor, simple procedure to just maintain the skin on the neck, to maintain the elasticity on the neck.